hours this year so far. So everybody usually typically well exceeds the minimum requirements.
And how often do you have to update your training or certification?
For the paramedic, every 2 years. For the fire, every year.
And as part of your training, are you trained in the Heimlich maneuver?
Yes.
And tell me if you could explain exactly what the Heimlich maneuver is.
Just trying to dislodge a foreign airway obstruction in the upper airway. It's typically done by bystanders.
And to your knowledge, how is it generally performed or taught or, I guess, visualized as to how to do the Heimlich maneuver?
Typically, you have a classroom portion, and then they give you some mannequins to practice with.
And what portion of the body are, I guess, you taught to have to, I guess, touch or handle in order to do the Heimlich maneuver?
It's the abdomen just below the rib cage, just below the sternum, and you're forcing up a little bit.
In your 25 years as a Henry County firefighter, have you, paramedic, have you had occasion to have to perform the Heimlich maneuver?
I have never performed the Heimlich maneuver.
And why is that?
That's because typically the bystanders are the people that are performing the Heimlich maneuver. By the time I get there, it's either dislodged or the patient's worse off and I have to go to the next step.
And let's talk about the ones where it's been dislodged. Have you ever had to treat someone where possibly the Heimlich maneuver was not performed by someone who was trained to do it?
Yeah, typically it's a bystander that may or may not have training, and I've never, like I said, witnessed that because I'm typically there after the case. But usually the person is happy to be breathing again, and no notable injuries that I have noticed at that time.
Okay. And tell us a little bit about CPR and your training in that and exactly what CPR is.
CPR is basically breathing and mechanically moving the heart for the patient when they're not breathing and their heart's not working. So that's something that we typically do. We do quite a bit in this county. It's a very busy county. And that's what we'll do to try to jumpstart the heart, see if we can give them a chance.
And is there a difference between how you perform CPR on an adult and how you perform it on a child?
There is. It's typically the depth of compressions is for the compression is going to be on your chest. The depth of compressions is not quite as far on a child as it is an adult. It's about a ½ inch difference, though.
And when you talk chest compressions, is there a difference on what type of chest compressions you utilize on an adult versus a child?
Yeah, the chest compressions on adults typically two-handed, and a child's typically one-handed, and infants even the fingertips. And
in your course of your career, have you had to deal with anyone who's had CPR that was performed by someone who was not a medical professional?
Yes, most of the time the bystanders or lay people are performing the CPR before we get there, and they're doing the best they can, but a lot of the times it's not correct.
And have you, in those instances, seen where there were injuries if CPR was not applied correctly?
Not that I have noticed.
Let me ask you, were you on duty on November the 17th of 2015?
Yes, ma'am.
And did you get a call at some point in time in regards to a 2-year-old child?
Yes, ma'am.
Do you recall what time that call came in?
I would need to reference some paperwork. I can't quite remember it. I'd hate to say the wrong time.
Keep that up there.
17:42:36.
And what time is that in?
5:42:36.
And do you know what time you arrived, what location were you going to?
I was going to 1521 Lincoln Terrace, McDonough, Georgia.
And what time did you arrive at that location?
It was this is going to be the ambulance report that I have in my hand. I was on the fire truck, so it was a little quicker, not very much, but it was 10.5 minutes. So the other report has the correct time on it. If I read this time, it's not my time. Yes, that's yes, ma'am. So we arrived on the scene at 17:53:16.
And when you arrived, and you say we, who were you with?
Myself and firefighter Ken Jones.
And I believe you were on a fire truck. Is that what you
Yes, ma'am.
And what type of equipment do you have on that fire truck?
As far as medical goes, it's an ALS, which is Advanced Life Support Fire Truck. It has a jump kit or a med bag that has the life-saving cardiac drugs in it. Also a automated defibrillator.
And when you arrive at that scene, what happens at that point?
Arrive on the scene, of course, we've already gotten some information on the way to the call that CPR was already in progress, meaning the child was not breathing and had no pulse. Arrived on the scene and saw, if I remember correctly, it may have been in the cul-de-sac. I may be wrong on that, but it was the front door was open. I exited the truck, obviously called on scene, grabbed our equipment, and headed towards the house. Once I walked into the house, I typically, like I always do, announce fire department very loudly, and I heard someone say with a female voice, "I'm in here."
Did you make entry into the home?
Yes.
When you made entry into the home, what did you observe?
It was actually a very clean home. I did observe that a female was was delivering rescue breaths to what appeared to be a 2-year-old child laying on the floor in front of a coffee table.
And could you tell whether or not that female was on the phone or not?
Yes, she was on the phone, and she actually said they are here when we walked in, and I assume that was Henry County Dispatch. It's typically the case.
Was she on the phone? Was she holding the phone? Was she on speakerphone? Do you recall where?
I don't recall if it was speakerphone or if she was holding it. I don't recall that.
And you said that she was giving breaths.
Yes.
Okay. And who was she giving breaths to?
Apparently, Laila Daniels. Daniel.
I'm sorry, I didn't mean to interrupt.
That's okay.
Okay. And when you say breaths, is that just kind of describe that?
It's rescue breathing. Our 911 system's giving them, information on how to breathe for someone that's not breathing. So she was giving the breaths to the child because she apparently was not breathing. So she had her mouth on her mouth, trying to breathe for her.
Did you observe her giving any chest compressions like you talked about earlier?
I did not as I was walking in.
Once you get inside and you see her giving breaths, what do you do next?
Start looking at the child as I'm walking up, getting a general impression on what I feel is going on. The skin is very pale, cyanotic, which means blue around the lips. It's obviously not perfusing very well, which means typically that they're not breathing or their heart's not beating.
Let me stop you there. So what did you observe about the color of her skin?
It was very pale and blue around the lips, meaning cyanotic or blue around the lips.
And did you happen to touch her or feel her?
Yes, her skin was warm to the touch. Her core was warm. Her extremities were not as warm as I would like to have felt, but they were still warm, but I wouldn't call them cool at that point.
Why would you not like to see them as cool? What concern does that?
It's just on the amount of downtime. If they've been down too long, you have to make a decision as a paramedic whether to work the child or work the patient or not. Of course, with a child, you typically go over the top a little bit. And core was warm, so that's all we needed to know to move forward with the treatment.
And when you say core, what part of the body are you talking about?
The trunk, the entire core here of the body was warm.
And the extremities, what part of the body are you talking about when you describe
Your hands and your legs.
So you touch her core and you touch her arms. What do you do next?
I feel for a brachial pulse, which is under the arm right here, which is typically how you do it for a child. And I felt no pulse. And at this time, all at the same time, I'm looking for your typical airway breathing and circulation. So I'm making sure that seeing if she's breathing at the same time as I'm doing this. And so, there's a list of things that a textbook tells you to do, which is to check for the airway, check for the breathing, check for circulation. When you've been doing it a while, you kind of do all at one time, all within just a few seconds of each other. So that's what we did, and I grabbed a hold of the brachial artery and did not feel the pulse as I'm watching the airway to see if I see any kind of movements, any kind of chest rise, any kind of abdominal rise and fall from breathing.
Did she have a pulse?
No, did not have a pulse.
Was she breathing?
Was not breathing.
And what did that mean to you?
Well, the call had that she's at this point she's clinically deceased at this point.
What do you do, having that information that she's clinically deceased?
That means we need to move forward to the next step, which is to initiate the life-saving measures that we can do. The call come out as a choking call, so I just the first treatment that I was going to do was try to clear an airway, just in case there was an airway obstruction. Typically, pediatric patients, once you clear the airway obstruction or take care of any type of respiratory problem, they're very resilient and they come back a lot better. So we want to try to rectify that first, just in case. So I took the child and done 5 back blows where I have to turn her over. And I hold her face in my hand. And that's typically correct. And then you lean them down in this fashion here so gravity works towards your benefit.
And I'm going to give you State's exhibit for demonstrative purposes only 228. And if you could demonstrate the actions that you took with Layla using State's exhibit.
And I'm doing this on my knees. The child's laying here. Built a little smaller than this. But you grab by the face and you turn over here where you can hold the head and support the head, and you give 5 back blows in this direction here. Just in case something's lodged, we can maybe get it out. If it is, my hand's here to support the head and also to catch whatever just come out. So I deliver 5 back blows, just kind of one of those things to try just before we get started good. And gag the 5 back blows. Rolled her back over and begin the next phase.
And let's talk about when you rolled her over to her back. What did you observe, if anything?
Did notice quite a bit of bruising. I'll just put this down here. On her back.
Was that prior to you administering those 5 back blows that you talked about?
Yes, it was a significant amount of bruising on her back, all the way from her diaper up to her neck.
Did she have on any clothing when you came into the home?
Just a diaper laying on a navy blue towel.
And I'm going to show you what's already been admitted into evidence State's exhibit number 1. And you can direct your attention to the back screen behind you. Is this what you observed, the injuries that you observed to her back when you turned her over for this back blows?
Yes, ma'am. And as I saw that, I asked the female that was sitting there, what's her medical history? And that's a typical question we ask. I want to find out if the child's sick or something of that nature, so we'll know what course of action to take next. But she said she wasn't sure that she was a new foster child.
And what did you take that to mean when she said a new foster child?
Well, in my thought process, of course, everything that I do is going to be, it doesn't matter. We're going to go exactly down the line as far as protocols goes. But I thought to myself, this poor little girl was in a bad situation. Thank God she got out of it. Because I had no, it's a new foster child.
What's the next thing that you did?
Okay, then we roll her back over on her back. And have my partner, he's going through the jump kit, asking for a BVM, which is a bag valve mask. It's the bag that has the face mask on it that we breathe for him. And as he's getting that out, we're starting compressions. And about that time, just before we really are able to get started on virtually anything, the ambulance calls out on the scene. And I believe it was it's a little over 2 minutes later. Just give me a second, I can tell you. 17:55:30 is when the ambulance arrived on the scene. So that's 2 minutes and 14 seconds later. Then we arrived. So all this happened in 2 minutes and 14 seconds. So then at that point, when I heard them arrive on the scene, because it is a child and I'm able to move them easily, picked her up with a towel and ran out to the ambulance and met the ambulance crew.
Let me ask you, prior to, after rolling her over and seeing the bruises on her back, were you still of the mindset that you were dealing with a choking call?
When I rolled her, I'm sorry, I asked that again?
When you saw the bruises,
Yes, ma'am.
did it change your mindset as the type of call
Yes.
that you were?
Yes, it did.
At that point, what was your mindset as to this call?
I thought like I said, I thought poor little girl got out of a bad situation. That's exactly what I thought. So I thought this was a more, maybe even a traumatic thing at some other time so, it's still acted and treated just like, of course, we cover all bases when we're doing it, trying to make sure that we don't have a foreign airway obstruction.
And I want to back up to that. When you did those back blows, did anything dislodge from her throat?
No.
At any time, did you see anything come out?
No.
And did you said 1 round of 5 blows, did you do any more blows after that?
No, ma'am.
When you arrived and she was not breathing and she did not have a pulse, could you have called it in the field?
That's kind of a judgment call, and yes, we could have. An adult and at this time we didn't know the rhythm. And an adult is not as easily moved, so we would have stayed there, we would have brought our monitor in and seen the rhythm and had to make a judgment call on how the patient's skin felt, the rhythm that's on the monitor. And typically we'll work them in the house, meaning we'll start CPR and we'll go through several rounds of drugs, call the doctor and get permission to call it and not work it at that point.
Did you do that in this case?
No, ma'am.
Why not?
It's a child, so we're going to go over the top.
Once the ambulance arrived, what did you do?
Picked the child up and ran her out to the ambulance in my arms and put her in the back of the ambulance. The ambulance crew immediately just got out and got right in the back of the ambulance along with my partner, and we began the next phase of our working.
And what's the next phase of the work?
All right, so we're doing CPR, and which is, someone's breathing with a bag valve mask. I can't recall who was breathing her at that time. There is a difference between EMS skills. There's a paramedic and then there's an EMT. So there's 2 paramedics on the scene and 2 EMTs. The paramedics has responsibilities and the EMT has responsibilities. So the paramedics are the ones that are giving the drugs, intubating, delivering the shocks. And the EMTs are the one that's breathing, doing the compressions, getting the IV, those types of things.
So you have 2 paramedics and 2 EMTs. Is everyone working?
Everyone's working.
What were you doing?
I was getting the airway, which means that I use some tools to stick a tube down her throat to assist her with breathing so that I can breathe for her.
I'm going to show you what's been marked in Instruction Defense Counsel as States Exhibit 229, 230, and 231.
Yes, ma'am.
Do you recognize those?
Yes, ma'am.
And do they fairly and accurately depict these instruments you were just talking about?
Yes, ma'am.
I'd ask that States Exhibit 229, 230, and 231 be admitted into evidence.
Any objection?
Would it,
For a minute?
would it assist you to utilize those tools in order to demonstrate the action you took to intubate Layla Daniel?
I'm sorry, I didn't hear you.
Would it help you to show the jury the
Yes.
instruments you used?
Yes, ma'am. Okay. I'll go over it piece by piece. This is just a display, obviously. So this is just showing the anatomy we have of the upper airway, and I'll show you what these devices do. This is an adult upper airway, so of course a child would be smaller, but everything is the same except for their size.
Are there special tools that you have when you're dealing with a child versus an adult?
Yes, just like this, it's called a laryngoscope blade. On an adult, it's bigger. The handle is bigger, the blade is different, and you can see that when you turn it on, the light comes on, so that I can see. It gives me a flashlight down in the throat. This is called an endotracheal tube. Okay, so this is the tube that goes down the throat into the trachea. That's the windpipe that goes into your lungs, so that you can breathe the patient. This is called a stylet that goes into the endotracheal tube and allows me to manipulate the tube into a position that I want, so that I can slide it in between the vocal cords. You have to slide this tube in between the vocal cords for it to work. It won't work if it goes in the wrong hole, which means it's in the stomach. We can't breathe in the stomach, right? So we have to bring through the lungs. This is where this comes into play. So it's probably hard for me to show everybody. I'll do my best. But you have this is obviously half of the mouth here. We got the tongue right here, and right below it there's a little flap where my finger's at called the epiglottis. And it pulls up. There's different ways to intubate, but I use the straight blade, which grabs the epiglottis and pulls all this anatomical structure out of the way. And when it pulls it out of the way, if y'all can see a V in there, that V is the vocal cords. That's where you pass the tube through, and it's critical that you pass the tube through the vocal cords for this to work correctly. So I take this device here, and I enter the mouth like this, and I move all this anatomical structure up, and I grab the epiglottis and move it up out of the way. It gives me a flashlight where I can see the vocal cords very well, and then I can pass the tube through the vocal cords.
Let me ask you, with Layla, when you put the instrument in her mouth and pulled it up and turned the flashlight on, did you see anything in that area, in the vocal cord or in her throat in any way?
No, ma'am. No obstruction at all. There was some thick yellow substance around her lips, but that's fairly typical when somebody's been administered rescue breaths.
Why is that typical? What happens with your body if you've been administered rescue breaths?
Rescue breaths, it's not as good as an endotracheal tube, so you're breathing and you've got two holes, one going to the stomach, one going to the lungs. And as you're breathing, it's going in both holes. So it inadvertently gets into the stomach gets distended, and then once it gets full, it vomits. So you can have some vomit just come back on your lips. That's fairly typical.
After you put the tube in to see down the throat, what's the next step that you take?
All right, so I put the tube in. Obviously, I use this scope. I put the tube in between the vocal cords just as this. We take the stylet out because I no longer need it. At this point, I hold it. A partner puts a bag valve mask on the dish, and they breathe it. And we use a stethoscope to listen to the lungs to make sure the air is moving throughout both lungs and make sure you're in the right spot. And then once that's occurred, we secure it with a Thomas tube holder.
Let me ask you, when you went to put the tube down Layla's throat, was there any obstruction or any difficulty getting that tube in?
There's no difficulty at all getting the tube in, and once we started using the bag valve mask, it performed adequately. Typically, if there's a foreign airway obstruction below the vocal cords, there is some resistance with the bag, and I did not feel that.
When you didn't feel that obstruction, did you have any thoughts that went through your mind?
There was no obstruction there.
And I'm showing you what's already been entered into evidence, that's exhibit number 5. And is that the strapping here, what you were indicating that you put onto Layla's mouth?
Yes, secure the tube. It's called a Thomas tube holder. It's a piece of plastic that has a bite block in it that goes in between your teeth. Hold your mouth open so your teeth does not obstruct the tube, and it has a little mechanism that twists on the side, a little nylon screw that twists on the side that secures the tube to the Thomas tube holder. The strap goes around the neck, the back of the head, and velcros to the body.
In your experience, does that tubing mechanism and strap cause any injury?
No, ma'am.
I'm showing you what's been marked as State's Exhibit number 232. Would the strapping mechanism that we're looking at in State's Exhibit 5 have caused what we see in State's Exhibit 232?
Not typical, no, ma'am.
So once you have the tube secured in and you begin to bag her, what is the next steps that you take?
And at this time, there's 4 people working, so my job was to get the airway, which we did, and other people are doing other things. So we're continuing the whole CPR regimen and following what we call ACLS protocols, advanced cardiac life support protocols.
And what do those protocols include?
It includes, obviously the CPR portion of it. We're going to put her on the monitor so the cardiac rhythm is showing, and deliver the appropriate cardiac medication for that rhythm.
Okay. Let's talk about are the compressions that's being done? And with State's Exhibit 228, can you demonstrate to the jury what type of compressions and how they will be applied to them?
Like I said, I'll slide this out of the way right here. Sorry. So typically it's in the nipple line for a child of this age. It's one-handed, 1.5 inches depth at a rate of at least 100. Okay, we don't have to stop, do the 15 to 2, which means 15 compressions to 2 breaths, or 15 or 30 compressions to 2 breaths once you have an advanced airway, which is this endotracheal tube. Then it just is a non-stop thing. So it's non-stop compressions once this is in, which that got in pretty quickly.
And does that, the tube, the intubation, allow you to breathe for Layla?
Yes.
At any point, did Layla start to breathe on her own?
No.
And you showed chest compressions. At any point, would it require compressions down below in the pelvic area?
No, ma'am.
In the groin area?
No, ma'am.
In between her thighs?
No, ma'am.
On her back?
No, ma'am.
Under her neck?
No, ma'am.
As you're breathing for her and doing the compressions, what else is happening?
We're applying the cardiac monitor to see what rhythm she was in, cardiac rhythm,
And why is it necessary to determine what rhythm she's in?
so that it can guide us on what cardiac medication we need to administer for that rhythm.
And what was her rhythm?
Asystole, which is the flat line, no activity.
Do you defibrillate her at any point in time?
No, that rhythm does not require defibrillation
Why not?
because there's no activity for it to try to jump start, if you will. Because when it's flat line, there's no activity at all.
And so she was flatlined.
Yes, ma'am.
What do you do to try to provide treatment?
We continue CPR and breathing, and then we can administer epinephrine. That is the only drug that you can give for asystole.
And was that done in this case?
Yes.
And do you know how many rounds was done?
Per the report, it was 3 rounds.
Were you giving those rounds?
I was not.
I'm going to ask you about State Exhibit number 5. Did you note any injury or bruising in State Exhibit 5?
Did I note any?
Do you see any bruising?
It just looked like and I'm not 100% sure, but it looked like we had some on the nose here. It may be a little bit of crust from some vomitus on one side, but on the tip of the nose, it looked to me like we had some bruising.
Would that have been come from any treatment that you provided on that day?
No, ma'am.
And what about down here in this area right here on the screen?
No, ma'am. That's too high for compressions.
So you're giving breaths, compressions, epi. What else is happening?
Of course, the cardiac monitor. And then at this point, we move to the phase where we've got an airway secured with an endotracheal tube. We know what rhythm she's in. We know what medicine we need to give, so that's what we're doing. So now we have time, if you will, because we've gotten all the stuff started. And now it's kind of a time to step back and say, okay, what's caused this? And this is where you go over your reversible causes, meaning, all right, what caused it? So one of the things that we can do in the back of an ambulance is take a blood glucose level, see what their sugar is. So that's typical of what we do on all our cardiac arrest patients. So we went to take a sugar, meaning we pricked her finger, got some blood out of it, and tested it.
And did you find anything from that test?
I did, and it wasn't a remarkable finding. I probably had to dig around in the report to find out what number it was. But as long as it wasn't low, that was the issue, and it was not low.
What else are you doing at this time? Let me ask you, are compressions and breath still being given to Layla while you're doing this assessment?
Yes. Typically, the EMTs are doing those 2 things, and the paramedics are giving the drugs. Of course, once they secure the airway, then we're bouncing things off each other to say, what's caused this? What can we do to try to reverse it?
And what's the next step that you take?
Okay, so then we're going over her body from head to toe at that point to see if we find something that's abnormal. You know, with a child, it's a little different because there's a lot of things that doesn't apply to a child, such as, you know, typically a 2-year-old's not going to overdose on drugs, typically. So.
And let's start with her head. We've already talked about the nose area. Was there anything else in her head that you found, I guess, to be notable?
I don't recall anything on her head that was notable.
I'm going to show you State's Exhibit 21. Did you notice this as you were doing an overview of her body?
I did not notice that.
Is that something that would have been caused by any treatment that you were providing that particular day?
No, ma'am.
What other things did you notice as you were checking her over?
Was, you know, obviously the bruising. There was a bruising on her back from her diaper up to her neck. She's laying on her back at this time, so we noticed some bruising on her pelvis and both wrists. When we was doing the D-stick, I can't remember if I was the one that performed the D-stick, which is the blood sugar test, but we did notice in my view that I took her left arm, and picked it up and said, "Is her arm broke?" And I manipulated her arm just a little bit to see if it had any kind of movement or crepitus, and I didn't feel any. But the arm appeared to have a slight curve in it.
And so what did that tell you when you asked the question, is the arm broke?
It appeared that I was concerned that it may have been broke right then. And, you know, at that point, and it maybe even be moving. But it wasn't. It felt intact, but it did have a bow in it.
And I'm showing what's been marked and introduced into evidence of State's number 34. Is this the arm that we're talking about?
Yes, ma'am, it would be the left arm of the child.
In what area did you notice that appeared to have a bow in it? And there's a pointer right there if you want to use it to point it out.
Okay. Obviously, this is the wrist, the elbow. So between the wrist and the elbow, you see this deformity.
And did you notice anything about the other arm, which is depicted in States number 36?
No, ma'am, other than the bruising on the wrist.
And would that have been caused by any of the medical treatment that you provided to her that day?
No, ma'am. And to back up and say the bruising that we noted was there before we even started our ACLS treatments.
And States Exhibit number 27. Did you notice that bruising?
That looks to be the back of the neck, and I did see that when I rolled her over for the back blows.
And I think you talked about the pelvis area, which is depicted in States number 3. Are those injuries that you talked about in the pelvis area?
Yes, ma'am.
And if you could use the pointer as to what areas you're talking about.
Just notice some bruising here, or discoloration in these 2 areas here.
Now those blue, what looks like to be blue pads that's on her in that area, would they have contributed to those bruising at all?
No, this is just a sticker. It's electrode, so it's just like putting a Band-Aid on.
Were those bruises there prior to you? Did anyone that was working on her between the 2 paramedics and 2 EMTs put those stickers on her?
Yes.
Were those bruises present prior to those stickers being put on?
Yes.
And States Exhibit number 48.
Same thing, yes, it was there before the electrode was put on.
Okay. And this area right here that's kind of reddish, was that there as well?
Yes, ma'am. I mean, I don't recall the specifics of it because of what was going on, but I do remember there was being some discolorations in that area. I can't say without certainty that very dark spot was there, but there was discoloration there.
As you're doing the observation of her body, what else is going on?
We're continuing with the CPR and the breathing, and every 3 to 5 minutes we're administering a round of epi. They do. I did not perform this skill. This is typically, like I said, an EMT skill. They will, and it sounds horrible, but we have something called a bone gun, a bone drill, that drills a needle into the bone in the leg.
Did you do that?
I did not.
Okay. Let me ask you. At some point, do you arrive at the hospital?
Yes.
How long is the trip from 1521 Lincoln to the hospital?
It is 16.4 miles away. We departed the house at 18:09:03 and arrived at the hospital at 18:26:39.
And once you arrive at the hospital, what occurs?
En route, of course, we call them and let them know we're coming and what we have and what to expect. Once we back up to the ambulance, to the ramp at the hospital, at the ER, we're collecting our equipment onto the stretcher, and we go in and give report. The room that we went into this particular time was just inside the door to the left.
And at that point, are you done with your medical treatment of Layla Daniel?
We will assist the ER staff for a short period of time until everything gets changed over and we're given our report to make sure that all equipment gets changed over, all information gets disseminated. And if they need us to stay in and assist with the arrest, we will. There was quite a few people in the room at that time. But sometimes you get stuck in a position where you just need to stay there and continue doing what you're doing. And I remember that's what had happened with me.
At some point, did you turn over care to Layla to the hospital?
Yes, ma'am.
In your 25 years as a paramedic, have you ever seen the type of bruises that you observed on Layla as to someone who had bad or improper Heimlich?
No, ma'am.
In your 25 years as a paramedic, have you ever seen someone to present with those type of injuries from improper CPR?
No, ma'am.
Nothing further.
Thank you. Awesome.
Have you ever been told, you arrived at a scene and been told that someone had applied improper Heimlich?
No, ma'am.
So you don't know what improper Heimlich would look like?
No, ma'am.
Because you've never been told that anyone did it improperly, correct?
That's correct.
And the same is true for CPR.
Yes.
You don't know what a person looks like after improper CPR because you haven't been told.
I've witnessed improper CPR and then taken over that CPR.
And you've witnessed improper CPR on whom?
On several calls I ran, most of the people that we run cardiac arrest with, the lay people perform the CPR not correctly.
And are these on children or on adults?
Both.
Both. And when you say they don't do it correctly, what is it that they don't do correctly?
It's numerous things. They're upset, they're very nervous about it. So they could be doing it in the wrong area, not enough. pausing too much, that type of stuff.
But you've never seen them give adult CPR to a child, right?
Well, that's kind of hard to disseminate because the only difference is a half-inch compression depth.
With the adults, it's a half inch more?
Yes, ma'am.
You go 2 inches down,
Yes, ma'am.
but you go 1.5 inch down for a child?
Yes, ma'am.
And you use 3 fingers, correct?
That's according to how big the child it is. It's on an infant, it's typically encircled around the infant and use your thumbs, or you use 2 fingers.
Okay.
If it's a little older, 2 and above, then it's kind of a judgment call on the weight of the child. You'll use 1 hand.
And do you know what she was instructed to do? with
No, I don't.
CPR? So you have no idea what she did?
No, ma'am.
And you said the house was clean?
Yes,
Things
ma'am.
were in order?
Yes, ma'am.
No signs of struggle?
No, ma'am.
And you could hear at one point with the BVM, you could hear bilateral breaths, correct?
Once I got her intubated and listened, I could hear bilateral breath sounds.
Okay. And with regards to the Heimlich maneuver, it's a different process for a child than it is for an adult, isn't that correct?
Yes.
And how do you do a Heimlich on a child?
It's a little more difficult according to how tall they are. Typically, you do the back blows like I did when we got there.
You do the back blows.
Yes, ma'am.
You hit on the back.
The upper back.
And sometimes people can hit in the wrong place, can't they?
Sure.
You wrote a report in this case, correct?
Yes, ma'am.
When did you write the report?
It was the night of the call.
After the call was over with?
Yes, ma'am.
About what time?
That's tough to say. It was pretty late. May have been even closer to midnight.
It's fair to say that you put in your report everything that happened that you thought was of import.
Yes,
correct?
ma'am.
And you didn't have any conversation with Jennifer Rosenbaum other than to ask her about any history with the child, correct?
That's correct.
Otherwise, you didn't question her,
No, ma'am.
you didn't talk to her, you didn't have a conversation with her.
No, ma'am.
You were working on the child.
That's correct.
Thank you, that's all I have.
Those bilateral breaths that you were hearing, was that after you had intubated her?
Yes, that would be mechanical ventilation that we were delivering.
Okay. Does that mean that she was breathing on her own now?
No, ma'am.
Were you breathing for her?
We were breathing for her.
And when you were performing CPR, were you using your fingers, 1 hand, or 2 hands?
1 hand.
And Ms. Mull asked you about, let me ask you, when I said improper, have you ever been on the scene where someone, a layperson, has reported that they have given a Heimlich maneuver?
Yes.
The person or persons that you observed after that layperson gave the Heimlich maneuver, have you ever seen anyone look like Layla Daniel did when you saw her?
No, ma'am.
The same thing with CPR.
No, ma'am.
You come up on scenes where laypersons have done CPR.
Yes, ma'am.
Has any of those people ever looked like Layla Daniel did?
No, ma'am.
And Ms. Mull asked you about those blows to her back. If someone is delivering blows to her back improperly, would you expect to see injury from the top of her neck to the top of her buttocks?
No, ma'am.
Nothing further.
Sir, true though, if it was improperly being done, it can be improperly done in a number of ways, isn't that correct?
Assume you're speaking of the Heimlich maneuver?
Yes.
Yes, ma'am.
It can be, so what you have seen in your experience may have been one way of applying the Heimlich maneuver. And Mr. Rosenbaum may have applied the Heimlich maneuver in a different way than what you've seen, correct?
Yes, I assume so. Yes, ma'am.
And where in your report did you write anything about a broken arm or a bowed arm?
I did not write that down.
You didn't write that anywhere in your report?
No, ma'am.
It's not in the EMT's report either by any of your coworkers at all, is it?
No, ma'am.
If you hit somebody on the back, you can cause a bruise.
Yes, if I hit someone on the back, I can cause a bruise, yes.
If you hit someone in the center, sort of in the waist, on the back, you can hurt someone and cause a bruise there, can't you?
Yes, ma'am.
If you do it all the length of the person's body, you can create a bruise in every position, can't you?
Yes, ma'am. If there's a heartbeat, yes.
And it's fair to say, is it not, that having somebody do compressions, 90 compressions improperly, if she's going further than 1.5 inches, that might cause some damage, isn't that correct?
I'm not at liberty to say that one way or another.
Why do you just go 1.5 inches?
That is what the AHA guideline, American Heart Association guidelines require.
And do they tell you what happens if you go more than 1.5 inches?
It is talking about, it could be improper, could cause damage.
Could cause damage to what?
I'm not sure.
Internal organs, isn't that correct?
I would assume yes.
Thank you, I have nothing further.
If they're doing improper CPR, let me ask you, do you see any injury to her chest area at all?
Not in this picture, no.
Do you recall seeing any injury to her upper chest area?
Not that I can recall.
Is that where you would expect CPR to be performed, in the upper chest area?
Yes, ma'am, between the nipple line.
Would you expect to see it down here, in her waist area and her pelvic area?
No, ma'am.
It wouldn't make sense to be performing CPR compressions on her pelvis.
No, ma'am.
What about on her vagina?
No, ma'am.
What about on her inner thighs?
No, ma'am.
What about on her neck?
No, ma'am.
What about under her chin?
No, ma'am.
So the area that you would expect to see bruising from a layperson not knowing how to do it, did you see any injuries?
No, ma'am.
And you said to Ms. Moe, sounded real important, bruising comes when?
It's bleeding. So if you're bleeding, you need a heartbeat to
Did
bleed.
Laila Daniel have a heartbeat?
No, ma'am.
Did she ever have a heartbeat when you went into the house, when she was in the ambulance, or when you took her in the hospital?
No, ma'am.
Nothing further.
Do you know whether she had a heartbeat prior to your getting there?
Prior to me getting there, no, ma'am.
You don't know, do you?
No, ma'am.
So when she sustained those bruises on her back, she must have had a heartbeat, correct?
When those bruises occurred, I would assume yes.
Furthermore, isn't it true that when you do one of the many improper ways of doing Heimlich maneuver is to come around the child and thrust upwards
Yes,
into
ma'am.
the abdomen region? And that's wrong, isn't that?
You do wrap around, you get into the abdomen, and you do thrust up towards the diaphragm.
But if you go too low, you end up inflicting injuries lower down beyond the abdomen. Isn't that correct?
I couldn't really speak of that. I don't know. I've never done that and never seen it done that low to answer that with any kind
But
of
you would
certainty.
expect that if you did it that low, you would get injuries, don't you? And that might account for the injuries.
It's a lot of soft tissue there. It's a lot of, you can move around a lot in that area without it causing any type of injury.
There's a spine in the back there, isn't there?
Oh, yeah.
And the spine,
With
is
enough
what's
force.
absorbing, with enough force,
Yeah.
you end up causing some serious damage. Isn't that true?
Yes, ma'am. If you've got enough force to make it to the spine.
Captain Gibson, do you know any of those bruises that you observed, if they happened on November the 17th of 2015?
Do I know if they occurred then?
Yes.
I do not know that.
Were they there when you got there?
They were there when I got there.
But you don't know when they came back?
I don't know if it was that day, days before. I do not know.
Nothing further. Nothing further.
Okay, thank you. You may step down and you're excused if there's no objection.
No objection, please, sir.
Okay. What's next?
He's another EMT.
Does anybody need a short bathroom break? Councilor Brooks, please. Ladies and gentlemen, what we're going to do is we're going to take a 15-minute break and then we're going to come back. Thank you.
Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth, so help you God?
I do.
Take a seat. Please state your true and correct name for the record.
Roy Scott Nix,
Okay. And how do you spell your last name?
NIX,
How are you currently employed?
with the Henry County Fire Department.
And what is your job with the Henry County Fire Department?
Being we're cross-trained, we're I'm a firefighter and paramedic.
And how long have you been a paramedic?
22 years.
And have you always been with Henry County?
As far as the fire department, yes.
I want to go ahead and bring you back to November 17th of 2015. Do you recall responding to an incident involving a child on that day?
Yes.
And do you, well, let me ask you this. Do you recall what vehicle you happened to be in on that day when you got the call?
I was on Rescue 3,
And
or excuse me, 13.
Rescue 13. And what is Rescue 13?
It's the ambulance that is stationed out of Station 13 on Highway 20.
Now, does the Henry County Fire Department have different vehicles? Different types of vehicles?
Yes, we have fire trucks, ambulances.
And can paramedics sometimes be staffing the fire trucks?
Yes.
All right. And vice versa?
Yes.
All right. When you were dispatched on this particular call, do you recall the time that you were dispatched?
I believe it was somewhere around 1740. If you have my run report, I could probably tell you the exact time.
Sure. Let me show you this to help refresh your recollection.
Yes. The unit Rescue 13 was notified and dispatched at 17:42:36.
Okay. And what information did you originally receive about this particular call?
It came in originally as a 2-year-old female choking.
Okay. You said originally. Did that change at all while you were en route?
Yes, it did.
And what did it change to?
It come into a person unconscious, CPR in progress.
Now, where were you, if you recall, when the call came in?
I was sitting at the red light at Macon Street in the city of McDonough Square.
About how far was it from your location to the incident location that you responded to?
It was like 8 or 9 miles.
And how quickly were you able to get to that location?
We made it in just over 11 minutes.
Did your report indicate the exact time that you arrived on scene?
Exact time on scene was 17:55:30.
Now, were you the first unit on scene?
No, sir.
Who was on scene when you arrived?
Engine 4.
And specifically, who was on engine 4?
Then it was Lieutenant Gibson, but now it's Captain Gibson and Ken Jones.
Now, do you recall when you first saw the patient that evening?
Yes.
And where were you when you first saw the patient that evening?
When I stepped out of the truck,
And where was the patient?
in Captain Gibson's arms coming out the front door.
And what did you observe when you first saw, and that patient was Laila Daniel, correct?
Yes.
What did you first see when you saw Laila Daniel?
She was in Captain Gibson's arms with a blanket or a towel wrapped around her.
And how would you describe her condition?
Lifeless. Yep.
What happened after you saw Layla?
Captain Gibson got in a truck first. I followed him in, and we immediately began assessing her. We determined again that she was not breathing, had no pulse. So we started CPR again, and we followed what we call ACLS protocol.
Okay. Now, did you ever hook her up to a monitor?
Yes.
And when she was hooked up to the monitor, what was her rhythm?
Asystole.
And being asystole, what does that mean?
There's no electrical function with her heart.
Was the heart beating at all?
No.
Was she breathing on her own?
No.
And at some point, did you all do something to assist her in breathing?
Yes.
All right. Did you actually intubate her to someone else?
No. Captain Gibson did.
What did you do? What was your role in the treatment?
I was lead medic. I was on the rescue, so I was lead medic. I made sure that we started the assessment, put her on the monitor. Captain Gibson intubated her, and made sure CPR was continued, and among other things that are normally done.
At some point, you mentioned that she was being carried in a towel, correct?
Yes.
At some point, was that towel taken off?
It was opened up on the stretcher. I can't recall for sure if she was taken off of it completely, but when we laid her on the stretcher, we had to open it up to expose her.
And when her body was exposed, did you notice anything?
Yes.
What did you notice?
Multiple bruising around her arms, hands, legs, and hip area, torso.
At any point, did you turn her over onto her back?
Yes.
And did you notice anything when she was turned onto her back?
Yes.
What did you notice?
More bruising.
Showing you what's been admitted as States Exhibit 67. Is this what you observed?
Yes.
Have you been a paramedic for 22 years now, correct?
Yes.
And have you responded to other calls for young children around 2 years old?
Yes.
Have you ever responded to calls where CPR has had to be used?
Yes.
In all of your 22 years of experience, have you ever seen anything like that from resuscitative methods?
No.
How about the Heimlich maneuver? Have you ever had to respond to a call where perhaps the Heimlich maneuver was used?
Yes.
And in all of your 22 years of experience, have you ever experienced anything like that day?
No.
So you said that you were working on the child. What means did you take to attempt to save her?
Of course, we done CPR. We established an IV line. It's interosseous. It goes into the bone in the leg, the tibia. We made one attempt at that. It failed. We made another attempt, and it succeeded in the right leg. Then we began pushing the cardiac drugs that we carry, and Brian intubated her.
I'm going to show you on the screen what's been admitted as States Exhibit 2. You mentioned something about an interosseous. What are you talking about? Can you see that here in the picture?
Yes.
And there's actually a pointer there if you want to use that to point. It's over on that. Oh, I don't know if that one works. Talk about the old school.
Oh, the old school. Okay. You can't see it, but it's the same thing as this right here in this leg.
And why are there two in her legs?
The first one on the left was a failed attempt.
And what do you mean by failed attempt?
When you insert the IO, you're supposed to aspirate, and if you get bone marrow back, you're in the right spot. If you do not, then you're not in the right spot.
So the first attempt, is it safe to say that you weren't in the right spot? How about the second attempt, the one where we see the bandaging?
We aspirated out of it, and so we secured it, and it will remain route of administering drugs and IV fluids.
So it was through this line that you were able to administer the drugs?
Yes.
What are some of the drugs that you administered to Layla on her way to the hospital?
The drug of choice and for the ACLS protocol and for his cardiac arrest is epinephrine.
At any point while Layla was in the back of the ambulance, did she ever have a heart rhythm?
No.
Did she ever breathe on her own?
No.
How long did it take you to get to the hospital?
I believe, according to the run report, 11 minutes and some odd seconds.
Okay. Do you remember? Does it say the exact time you
Yes,
arrived?
we
at the hospital?
arrived at the hospital at 18:26.
Now, the entire time that you were in the back of the ambulance were you all attempting to do resuscitative methods?
Yes.
And what are those, besides the drugs that we've heard about, what are the other means that you attempted to do?
CPR.
And was it you administering or someone else?
We all had during the swap out, we all take turns. You have to swap out every so often.
And do you recall how you administered CPR to the method you used to administer CPR
Yes.
to? And what did you do?
It's one hand, palm of your hand, center of the chest, center of the nipple line, center of the chest. Compress about an inch and a half.
For a 2-year-old child, is it part of the protocol that you've been talking about to use that one hand?
Yes.
Do you recall the coloring of Layla's skin while you were transporting her to the hospital?
Yes.
What was it?
Pale, ashen,
I'm sorry, I didn't hear the second word.
ashen.
Ashen. Okay. Now, at some point, did you get to the? Well, at some point, you did get to the hospital, right?
Yes.
All right. What did you all do when you got to the hospital?
We got to the hospital. We turned over care to the ER doctor and the ER nurses.
Now, I want to ask you about some of the other parts of her body. Did you notice anything unusual about any of her extremities?
Yes.
And what extremity did you notice something unusual about?
The left arm.
And what did you note that was unusual?
It just didn't look right.
when you say it didn't look
Slightly deformed.
Slightly deformed? I'm going to show you what's been previously admitted as State's Exhibit 34. You see on State's Exhibit 34.
Yes.
And where do you see what you viewed at that time to be slightly deformed on that picture?
Yes.
And if you can take that pointer and kind of show us what you were looking at.
This area right here.
I want to actually go through. This is State's Exhibit 36. Do you see any deformities on the other arm?
No.
Is there anything? I'm showing you State's Exhibit 19. Is there anything about the medical intervention that you all did that night that would have caused anything seen in State's Exhibit 19?
No, sir.
State's Exhibit 5. Was there anything about the medical intervention seen in State's Exhibit 5 that would have caused any injury to Layla Daniel?
No, sir.
State's Exhibit 27 I'm showing you. Was there anything that you all were doing in the back of the ambulance that would have caused any of the bruising seen in State's Exhibit 27?
No, sir.
And State's Exhibit 48. Was there anything that was being done to resuscitate Layla Daniel that would have caused anything in State's Exhibit 48?
No, sir.
And all the bruises that you saw on Layla Daniel, were they all there when you started the resuscitative efforts?
Yes.
Nothing further.
Wrote a statement, did you not?
Yes, ma'am.
And in the statement, you didn't say anything about a deformed arm, did you?
If you could hand me my statement, I can find out. I'll read it.
Show you, see if it refreshes your recollection.
No, ma'am, not my statement.
What happened to the towel or the shirt, whatever it was that you were laying the child on? What happened to that?
I can't recall.
Did evidence not pick it up?
I have no clue.
You're not a doctor, correct?
No, ma'am.
And Mr. Chase showed you this picture, Exhibit 27, and asked you if anything you did could have caused that, could that have been caused by somebody administering back blows and having done it too hard?
No, ma'am.
It couldn't have been. Do you know what caused this bruising?
No, ma'am.
So you don't know what caused this bruising?
I do not.
So you don't know that it wasn't pounding, somebody pounding on her back?
No, I do not know that for sure.
Thank you. Any redirect? Sir?
What part of the body does that appear to be?
Layla's neck.
Do you know how the bruising got on Layla's neck?
No, I do not.
So you have no idea what caused it?
No.
You don't know whether it was as a result of faulty administration of back blows?
I don't know that for sure.
Okay.
No. Thank you. You can step down. Any objections to witness being excused? No. Thank you very much. State will call us next witness.
State's going to call Officer Palmer.
Officer Palmer. I'll wait here, please, sir.
Can you please raise your right hand? You swear affirm the testimony you're about to give should be the truth and the whole truth, so help you God.
I do.
Please lower your hand and proceed. If you could, please state and spell your first and last name.
James Palmer, Palmer.
And your first name.
I'm sorry, James.
And Mr. Palmer, in 2015, were you employed with the Henry County Police Department?
Yes, ma'am, I was.
And what position did you hold with the Henry County Police Department?
I was a patrol officer.
And as a patrol officer, on November the 17th of 2015, did you get a call to the location of 1521 Lincoln Terrace?
Yes, ma'am, I did.
Do you recall what time you received that call?
Second, just look at my report. At 5:48 that evening, or that afternoon.
And is that the time that you arrived at the location or the time you received the call?
That's what time I received the call.
Okay. What time did you arrive at the location?
Hold on here, 1 second. Around 5:54.
And what was the nature of the call that you received?
It was a sick call.
And when you arrived at that location, what did you observe?
When I first arrived on the scene and I exited my vehicle, I saw a firefighter leaving the house without the front door with a child in his arms going, and he went right into the ambulance with the child.
And what did you do at that point?
I went and met with the mother, Ms. Rosenbaum.
And where was she at that time?
She was inside the house.
Did you observe anyone else inside the home?
No, I did not.
And did you speak with Ms. Rosenbaum?
Yes, I did.
And what did you speak with her about?
The child and what had happened.
And what did she tell you happened?
She told me that the child was choking on a piece of chicken.
And did she tell you what she did in response to that?
Yes, that she had tried the Heimlich maneuver at the kitchen sink but was unsuccessful.
Okay. And did she tell you anything else?
No.
Did she, when you say unsuccessful, did she indicate to you whether or not whatever the child allegedly was choking on came out?
Apparently, I would say no, since the fire department was so eager to get the child to the ambulance and take care of it. And she even, like I said, she did admit that she had called 911 when the child had turned white. But again, she also said to me that she was not very good at it, talking about the Heimlich maneuver.
And did she go into any further detail about not being very good at it?
No.
Did she describe to you in any manner what she had done when she talked about putting the child over the sink and doing the Heimlich?
She did not.
After that conversation, what did you do next?
Went back outside. The paramedics advised me, and at this point too, a sheriff's deputy had also arrived on scene as well with me, and advised us that that they needed somebody to drive the ambulance because both the EMS techs needed to work on the child, and the deputy had volunteered to drive it up to Henry Medical.
Where was the mother when you went outside and had this conversation with the paramedics and the Henry County Sheriff's Deputy?
She was still in the house.
What happened at that point?
Again, like I said, the deputy volunteered to drive the ambulance once they got, they meaning the EMS techs, once they got taken, ready or prepared, they left. Then the Miss Rosenbaum, after securing the house, also left as well to go up to Henry Medical.
When you say securing the house, did you go inside with her prior to her leaving? Or
No, I
securing
waited. I was outside. I'm just saying, make sure all the doors and everything was locked up, and then she went up to Henry Medical as well.
her? And what did you do?
I then went back in service.
At some point in time later on that evening, did you get another call to that location?
Yes, ma'am, I did around 6:20. I'm sorry, 6:20 is when I went back in service from there, and then 7:13 that same day, I got dispatched back out to the house.
What was the call at that time?
I was asked to go back out to the house and secure it, and meaning basically I sat on the house until CID arrived.
And did you do that?
Yes, ma'am.
Did you ever make entry into the home prior to CID arriving?
No, the house was locked. I couldn't have got in there.
Was there anyone else at the location when you arrived?
No.
Eventually, did anyone arrive?
Yes, CID arrived, and then like I said, Mr. and Miss Rosenbaum also arrived.
Did anyone go inside the home at that point once CID arrived and the defendants arrived?
Yes, all of us did.
And where did you go?
When you first walk into the house through the front door, if I remember correctly, there's a room that was on the right-hand side, like a living room or sitting room, whatever. And myself and Mr. and Miss Rosenbaum stayed there, and while CID conducted a search warrant.
Let me ask you, who arrived first, CID or the defendants?
CID.
And at the point that the defendants arrived, were the CID and yourself let in?
Yes.
And who let you guys in?
The parents.
And once you said you went inside the home,
Yes.
where did the Rosenbaums go?
They were in there with me, that same room. Like I said, I basically sat with them while CID did what they needed to do.
During the time you were sitting with them, approximately how long was that?
How long was I with them?
Yes.
Like I said, I got there around 7:13, and I did not leave the scene until 1:46 that morning.
And are you sitting with the Rosenbaums that entire time?
Yes.
And are you having any discussion with them?
We talked about just this and that, nothing important, but we never ever discussed the case at any point. We just, I'm sorry, but kind of just BS'd.
What was their demeanor during this several hours of speaking with them?
They were calm,
Did they ever appear to be upset, emotionally crying, or anything of that nature?
not that I recall.
Nothing further.
You don't have an independent recollection, do you?
I'm sorry?
I said, do you have an independent recollection, or have you read your report in preparation for coming?
I've read my report.
Okay, so as you sit here today, you don't remember actually 4 years ago what happened, but you've been refreshed by your report, correct?
Correct.
And so in your report, you said you made contact with Ms. Rosenbaum. So you must have gone in the house to make contact with Ms. Rosenbaum, correct?
Yes, ma'am.
And Ms. Rosenbaum told you the child was choking on a piece of chicken, correct?
Yes, ma'am.
She didn't tell you anything about whether the chicken had been expelled or not.
No, she did not.
And Ms. Rosenbaum told you that she placed the child at the sink and tried the Heimlich, correct?
Yes, ma'am.
And after the ambulance left to go to take the child to Henry Piedmont, did you see Ms. Rosenbaum leave the house and follow the ambulance to Piedmont Henry?
Yes, ma'am. I was the last one to leave,
And-
and everybody was gone when I left.
And she had a little girl with her at that time?
I did not see a little girl.
You didn't see it?
No.
Did you look in the car?
I didn't pay a lot of attention to it, but the only person, as I said before, that I ever saw was Miss Rosenbaum.
Okay, thank you.
Yes, ma'am.
Oh, one last question. Show you what's been marked as Exhibit 132. And ask you if you can identify that.
I don't recall this room.
You don't recall the living room, so you didn't go into the living room?
Again, if I remember, I was, like I said, I met her in the kitchen. Again, that's where she showed me, like I said, she talked about the sink and stuff. And that's not the room that we were in when I sat with them.
You sat in a little ante room.
Yeah,
And so you, as you're sitting here today, you're remembering based on what you've written in your report, correct?
Yes, ma'am.
Thank you, that's all I have. Just one-
Did Ms. Rosenbaum go back inside the home prior to leaving to go to Henry County, Piedmont?
I don't recall her coming out and then turning around and going back in.
So to your recollection, she never came out of the house while you were outside with the paramedics and the sheriff?
No.
Nothing further.
Are you saying with certainty now that she was not at the ambulance door with the child?
I said as best I can remember.
Okay,
Again,
so-
I'm just only saying what I remember.
And you only remember what you've read in your report, correct?
Yes, ma'am.
There's nothing in your report about whether she was or was not at the ambulance door?
That is correct.
Thank you.
Yes, ma'am.
Nothing further to say.
All right, thank you.
This-
You can step down. You're excused unless there's an objection.
Nothing to say.
Take calls next witness.
State calls, Dr. Lee Manning.
Right here, please, sir. Right through that gate, right there in front, wherever you are.
You want to raise your right hand to be sworn? Do you swear or affirm that the testimony you shall give in this matter will be the truth, the whole truth, and nothing but the truth to help you God? You can put your hand down. Please state your true and correct name for the record.
I'm sorry?
State your name for the record.
Dr. Balu Mani.
Okay. And sir, how are you employed?
Can you spell his name?
Sure. Can you spell your name for us?
Last name is Yam-A-N-I. First name B-A-L-U.
And Dr. Mani, what kind of work do you do?
What kind of work I do?
Yes.
I'm a radiologist.
And how long have you been a radiologist?
More than 35 years
And where did you first get your education in radiology?
in India.
And how long have you been in the United States?
34 years.
And are you also licensed to practice medicine here in the United States?
Yes, sir.
And are you a practicing radiologist?
Yes, sir.
All right. And where is your current practice?
I practice in Riverdale, Upper Riverdale Road, next to Southern Regional Medical Center.
I'm sorry, can you say the last part?
Upper Riverdale Road, next to Southern Regional Medical Center.
Next to Southern Region Medical Center. Okay, great. And do you sometimes read X-rays for hospitals?
Hospital?
Yes.
I used to be working in a hospital until 2017, so I was in a hospital.
In 2015, where were you working?
Piedmont Henry Hospital.
So Piedmont Henry Hospital? All right. And did you read some X-rays regarding a patient by the name of Laila Daniel?
I don't remember exactly, but I've been shown the x-rays I read by you.
Okay, and the name is actually on there, correct? The name of the patient?
I don't remember the patient name.
Sure. Let me have you look at State Exhibit 124. It's behind you.
Yeah.
Do you see the patient's name?
Laila Marie Daniel?
Okay. And are you the radiologist who read the X-rays in this case?
Yes, sir.
Okay. And so we're kind of looking. What kind of X-rays was it? Let me ask you this: was it the full body?
X-ray the whole body, yeah, correct.
X-ray the whole body. Okay. So I'll show you State Exhibit 125. This is just an X-ray of the skull, correct?
Yes, sir.
All right. How about 126? Was there also an X-ray done? If we could have the lights just come down. Is this also an X-ray that you read?
Yeah.
In States 126, did you see anything abnormal in States 126?
I'm unable to see anything abnormal in this X-ray.
Okay. How about States 127? What kind of X-ray is this?
There is a chest lateral view.
Okay. And States 128?
There is the entire spine lateral view.
How about States 131? What kind of X-ray is this?
There is the AP view of the left lower extremity.
The left lower extremity?
Yes, sir.
Okay. How about States 132?
There is another view of the left lower extremity.
There's the lateral view of the left lower extremity?
Yes, sir.
Great. And these are all, you said this was a full body X-ray, correct?
Yes, sir.
So you're reading all of these X-rays, correct? So far in any of these X-rays, did you find anything abnormal?
Not in this case so far.
Okay. Stage 133, what are we looking at here?
There is the AP view of the pelvis and upper thigh area.
Okay. So that was the AP view you said?
Yeah.
And so that would be anterior, posterior, correct?
Correct.
And if I'm correct, that means it would be shot from, the X-ray machine would be in front of the person and shot back.
From the X-ray machine in front of you and the film behind you.
Okay. How about stage 134? What are we looking at here?
This is the view of the right upper extremity.
And is this just another view of the right extremity?
Yes, sir.
All right. Anything abnormal in stage 134?
No, not in this.
All right. What are we looking at in stage 136?
This is the AP view of the right lower extremity, and there is an old subacute fracture of the proximal tibia.
So you said you see an older fracture of the proximal tibia.
Yes, sir.
Okay. And I'll give you the, I don't know if the laser one's here, but I'll give you this pointer. What are we looking at here when you said there's an older fracture of the left or the right proximal tibia?
If you look at here, there is the actual bone here, and this is the new bone, or the bone that's being formed after a fracture has been there. So what happens is when you have a fracture, the covering of the bone leaks blood, and the blood contains cells that can become bone. So these are new bones that are being formed to bridge the gap between the broken bone to join together.
Okay. And does this bone look like it is healing?
Yes, sir.
It's healing? It is healing?
Oh, it's healing, yeah.
Okay.
It has been there for at least a few weeks.
At least a few weeks?
Yeah.
Great. And it says stage 137. Is this just another view of that same extremity?
It's hard to see, but you can see the newborn formation reflected behind the proximal tibia.
I want to go ahead and show you stage 130. What are we looking at in stage 130?
This is the APV of the left upper extremity, and there is a fracture of them. This is called ulna, this is called radius. There's a mid-ulnar fracture. So look carefully, there are fuzzy areas around the fracture, basically meaning there is healing that's happening.
And from that, when can you start to see healing on an X-ray? About how long until you?
Initially, after the fracture, you develop blood pool there. In the blood pool, there are cells that are supposed to form newborns to bridge the bone. So this should be at least 2 weeks, 1 week to 2 weeks old to have this kind of fracture. The bone, even though the cells are there, the cell to become a bone, it takes at least 1 to 2 weeks. So this is at least 2 weeks old fracture.
Okay, at least 2 weeks old. How about at the other end? Can you give an approximation as to?
Right.
It probably is no more than X number of weeks.
Like within 1 to 3 weeks age.
So this break is approximately 1 to 3 weeks age.
Sorry?
This break is approximately 1 to 3 weeks
Correct.
old. Correct.
Correct.
Okay. And is stage 129? Are we looking at the same extremity?
It's the same fracture looking at in an opposite angle, and you can see the same thing. You can see a fuzzy newborn around it, and the fracture line right there.
Have you ever heard the term non-union fracture?
Non-union fracture happened after a long time. The fracture, when they are not really splintered well, and the fractured bones keep rubbing against each other, then they become sclerotic, and the bridging callus is broken many times, and they do not look like joining, because they have a sclerotic margin. This area where I see the fracture line will become white. So this is not a non-union. This is still a fracture in the healing process.
So this is not a non-union fracture, correct?
Based on my opinion, it's not non-union.
Okay. And do non-union fractures look anything like that?
I'm sorry?
Do non-union fractures look like that on X-ray?
No, non-union fracture will have more sclerotic appearing fracture lines.
And all the years that you've been a radiologist, have you ever seen a non-union fracture in a 2-year-old patient?
No.
Thank you, sir.
Dr. Marie, you talked about the 2 arms, correct?
I'm sorry?
You talked about the 2 arms.
2 arms?
Yes. You talked about the broken arm.
Broken bone, yeah.
Yes. And do you recall having written an impression of that arm? Did you write an impression?
I'm sure I write impression on all my reports, yes.
Okay. If I may ask you this, do you recall saying that this was a non-union, a fracture and non-union of the midshaft of the left ulna?
Non-union basically means it has not been splintered.
So it was a non-union fracture.
It's a fracture in healing phase without a splint in place.
And isn't it true that you wrote that evidence of subacute fracture and non-union of the midshaft of the left radius and right proximal tibia? Isn't that what you wrote?
Non-union basically means it is not splintered to become a closer opposition, so they unite faster.
Do you recall having called it a non-union fracture and non-union of the midshaft?
It's possible.
It's possible. Would it help you to refresh your recollection to look at that?
Oh, you can show me the report, yeah.
Do you have a paper copy?
I don't, Your Honor. I could make a paper copy.
Well, we're going to need a paper copy.
Okay. Your Honor, if I could have about 5 minutes and...
Okay. Let me get a sense for how much longer we have with this witness. Not much. If the parties will agree that what's on the screen is something that he can view, in other words, that it's authentically the document that we produced and made part of the record, then I don't have a problem with this procedure so long as when we're through with court today, there's an agreement and stipulation to supplement the record of this piece of paper. Is there any objection to proceeding like that? No. All right, let's go ahead.
Let me show you a copy of the medical report and see if your impression is that's a non-union of the mid-shaft.
Yes.
Thank you. I have nothing further.
Is that exhibit being marked to make part of the record?
I could join.
Let's wait until that's done.
Defense Exhibit 133.
Any objection? 133 submitted. D 133. Redirect.
Dr. Money, let's talk a little bit more about what did you mean in your report when you wrote non-union? Can you explain that to us?
The fracture bone is not opposed to each other. They are separated by a few millimeters,
So essentially, if I'm correct, the bone is not one piece.
not opposed to each other.
Okay. So is what you wrote in here different than the term non-union fracture?
Correct.
And why is that different? Tell us.
Non-union fractures are old, very old fractures that they are completed healing, but they are not really joined together. So basically they form a pseudo joint between the fractured bone. That is fracture non-union. This is maybe the term was not used correctly. This is the term used to tell that the fracture lines are not opposed to each other, meaning that they are potentially may go into non-union if you don't put them together closely.
Do you see that callus formation that you talked about on the x-ray in a non-union fracture?
Non-union fractures are old fractures. They'll have a lot of callus and they'll have sclerotic appearing broken areas. Non-union fracture is different from what I meant in the report was to basically say they're not opposed to each other. They're not being splintered appropriately.
So I guess my question, so let's break down. So when you say non-union, you mean that they are not perfectly lined up to each other? Is that correct?
Non-union means the bone is not going to join to each other because there has been a gap between them forming a pseudo joint space, basically meaning that they will not ever be one unit.
Is that what you see in this
No,
x-ray?
this is a healing fracture with the opposing surfaces of the fracture line not being splintered appropriately.
Okay. So in this particular x-ray, from what you can tell, how old is this fracture?
The fracture must be at least 1 to 2 weeks old and probably not more than 4 or 5 weeks.
Okay. So the term that you used in
Subacute fracture.
yes, the term you used in 133, the non-union, that is different from the term non-union fracture, correct?
Correct.
Nothing further.
All right, thank you, doctor. You can step down. Any objections, doctor?
Nothing stated.
Nice time. Okay, ladies and gentlemen, we're going to break there. And again, we appreciate your time and your attention. And thanks for another full day. We'll see you tomorrow morning at 9 o'clock.